Good afternoon, ladies and gentlemen, and thank you for joining us this afternoon. I'm Rob Pitts. I chair the Board of Commissioners of Fulton County, and I'd like to welcome you to GICC. And this is important for us because, as you probably know, we were originally located in the south part of the county at our aviation location, but it was brought to our attention that that was probably not the most convenient location in South County. So thanks to the generosity of Mayor Motley Broom here in College Park, she graciously offered us, free of charge by the way, use of this magnificent facility. So Madam Mayor, thank you very much. We're delighted to be here, and I won't belabor you with a lot of remarks today because I think it's very significant and instructive that our governor took the time out to tour this facility. And Governor, I want you to know that we in Fulton County, be proud of us. We led the state in testing, and we're leading the state in vaccinations, and our health equity initiative is one of its kind in the United States of America that is designed specifically to address people of color, blacks, Latinos, Native Americans, and Asians. So we're very proud of that effort, and I know that that's a special interest that you have, and I think you saw the impact of that here today. So with that in mind, I'd also like to recognize Dr. Lynn Paxton, who heads up our Board of Health at Fulton County, and we'll all be able to be here to answer questions for you, but in the interest of time, the Governor has a very busy schedule. So Governor.
Oh, thank you. Well, thank you, Chairman, and I'll be very brief today. I just want to tell you how much I appreciate what you and Fulton County are doing. Certainly the mayor's generosity with this site, what Dr. Paxton and her team, the local emergency management folks, just, fire, first responders that are helping here, many people after their shift's over coming to volunteer, the health department workers that are in there, and many other volunteers that are working at the site. I know for those of us that walk through there, it's very impressive to see. It's much like what Dr. Toomey and I have seen in other parts of the state. It's just local communities, local counties, local health departments getting the job done. And they're also, I think what's so great about this site is you heard the chairman say this and the voices of the South Fulton mayors and getting a site where the rubber meets the road to tackle one of the issues that we have in our state, and one that's quite honestly around the country, and that's with a certain amount of hesitancy in minority communities with taking the vaccine. And I think from what Dr. Paxton and her team was telling me today, how they're approaching this with our senior citizens is very innovative, working with other services that the county has and the other agencies that I know Dick Anderson is busy running every day here in Fulton County. So it was great to see the process. As you can imagine, I think today they're going to do about 500 vaccines. That's what they're going to do every day. They were quick to tell me they could do more if they had more vaccine, which is what I'm hearing when I go to every site. And that day will soon be coming. I wish we had the supply to send them more, and as soon as we get it, we will. And I think that's a great thing for the people of our state to realize, is that there's a lot of infrastructure just like this, not only at this site, but at 2 other sites in Fulton County and all over this state, where there's availability to give more vaccines right now, today, if we had that supply. And we know that that day is coming. Until we get there, I would ask people to continue to be patient while our healthcare heroes are doing all that they can every day to give every shot that we got to those that are in the 1A category. But also we need people, even as our cases are declining, our hospitalizations are declining, our percent positive to testing is declining, continue wearing your mask, continuing to practice social distancing where you can, follow the guidance and the guidelines, and let's keep those numbers going in the right way so we don't have another bump. And I believe we can do that, especially if we get more vaccine supply here in the next 30 days or 6 weeks or so. So with that, we'll open it up, and the whole team here can answer any questions that you guys may have.
Governor, as you're here at a county vaccination site, are you any closer to opening a state vaccination site?
We are. The team has been working on that to make sure that we're ready to roll on that. We know we're going to have multiple state sites at some point just when we get hopefully a huge supply of vaccine in the future. If Johnson & Johnson gets approved, we know that Pfizer and Moderna are finding efficiencies in their manufacturing process. It's going to help with supply and other vaccines potentially coming our way. What we want to do as a state is make sure that we're looking at areas that may be either underserved or there's not ample sites now. Obviously in the metro area, you can put sites very close together and it's still going to be very effective just because of the number of people. But there are parts throughout the state that they may not have the sites that from just a logistical standpoint that they need. And that's kind of what we're looking to see how we can either augment and work with what counties are doing or potentially what the feds may do. So there's a lot working there. GEMA is working with FEMA and the rest of our team, and hopefully we'll have some news on that very shortly.
Dr. Kemp, the DPH dashboard that just launched shows just a lot of racial disparity. Do you think there are any sort of pinpoints in the metro that might have less access, or how can we address that?
Well, I think a lot of it has to do with vaccine availability, but also obviously hesitancy in the minority community. I mean, we've been focused on this for a long time now, and Dr. Toomey and I actually spoke on our call this morning about that, part of their plan that they're still working on. We were in Gainesville yesterday working with the Latino community. As you all remember, we were at Morehouse School of Medicine last week, and we're going to continue to focus on areas. I mean, one of them that's underserved right now, if you look at that data, is Clayton County. So that's something that's on our radar to make sure that we're addressing those needs, and we will, and we'll be working with the county health directors as well. But we also know there's just been that hesitancy in the community, which is unfortunate, but look, it's just reality. It's not just Georgia, it's not just Atlanta, it's America. I mean, it's happening all over. We saw that early on with 70% of the people working in our long-term care facilities and first responders that wouldn't take the vaccine. One of the things the director talked to me today about was they're starting to see more law enforcement come in because people they're working with have gotten their second dose, they have gotten over that, they're seeing that there was no issues, and now a lot of that hesitancy in law enforcement and first responders is changing. And I think we'll continue to see that in long-term care facilities as well. But that's what the dashboard's for, is to give us that data where we can look and see, where we need to go, what do we need to do, whether it's in the African American community, Latino, Asian, whatever it is, geographic.
Can you talk about the phone call that you teleconference with the Biden folks today? Any word on when we're going to see an increase in the allotment?
I think I couldn't be on the call today. Ryan Loke, who's here, he can probably give you some details when we finish up. I think we may see just a slight uptick in supply, and I mean very slight. I think it's mostly from getting a sixth dose out of the current vials that we're seeing. Hopefully in the next week or two, we'll have a better idea of what our supply is going to look like, 3 weeks from them. I mean, that's the problem we have now. It's not necessarily a problem, it's just a fact. We just know what our supply is. It's going to be pretty steady here for the next week or two.
Governor, when will there be a statewide appointment system to facilitate better management of the vaccination process, specifically for those state-ran health appointments for vaccines?
Yeah, we're still working on that. I'll let you reach out to Dr. Toomey's team. She's got our budget hearing today, so she couldn't be with us as the legislative process rolls along. But she mentioned that on the call this morning. Obviously, we want to make sure when we roll that out that it's going to be ready to go. And so we're still working on that, but I refer that to her team. They've kind of been doing the day-to-day on that.
Governor, the state data shows that there's still a big gap between people who got the first dose and the second dose. Is that just because people haven't gotten the second dose yet, or is there a supply shortage, or what?
No, I think, and I talked a little bit about this yesterday with our folks in Athens, and I may let Dr. Paxton speak to this because she can probably give you the real-world example right here on the ground. A lot of people are just now becoming eligible for their second dose. I know in Athens yesterday, the supply they're getting every week they're allocating parts of that supply for folks that they know they got to get the second dose done, and then anything left, they're giving it to first-time shot makers. And I'll see if Dr. Paxton can add anything.
Yes, I just want to reiterate what Governor Kemp has just said. So we make sure that people who have gotten their first dose will get their second dose. One thing I would like to take advantage of to say is to remind people, though, that there's nothing magic about the first day they become eligible for getting the second dose. The CDC has already weighed in on this, and that it's perfectly fine if you get your second dose anytime within the 6 weeks of that time. So there's really no need to panic. We do know that there have been several private clinics and otherwise that because of weather shortages and all that, are getting their doses arriving a little late. So there's really no need to panic. You don't have to, you have some time to get your second dose. You will get your second dose. Thank you.
Can you talk about just this facility? How many people, once it really gets up and running and we get more allotment, how many people will be able to get vaccinated through here?
Well, we are totally confident that we could at minimum do 2,000 a day here. And again, I've watched this team. I'm so honored to work with this team, and every week they're surprising me with, surpassing what their previous expectations were. So at the moment we know for sure we could do at least 2,000, and possibly we could do more.